let's just get up and dance. Woohoo! I got one. Do I have a second? Do I have a third? Who's born a champion? Say hi. Woohoo! Give yourselves a round of applause, those of you who stood up. Good job. All right. Yeah, be careful. I'm in a weird mood today. So that may be a good thing. I'm not sure. Welcome for those of you who are guests. I'm Dr. Yachter, the weird one here. For those of you who are repeat offenders, raise your hand if you've been to a workshop before. Good. Excellent. How many of you guys have been to more than one workshop? Keep your hand up. More than 5 workshops? 10 plus club. Keep your hands up. 20 plus club. Keep your hands up. 30 plus club. Keep your hands up. 50. Going. Going once. Going twice. There we go. We could keep going. Yes. So you'll see tonight why people keep coming back to the workshops. Every time you come to a workshop, you keep learning, you keep growing. And it's my heart's desire that you leave with your cup full tonight. You're gonna get some good stuff. I want to challenge you. Yeah, come on up front. People who sit up front, they learn the most. They get the most out of it. Yep. And I have soap with my showers too. All right, so let's just get right into it. So as you guys know, always we do a workshop every month. If you haven't got the new workshop card for 2019, please do so. Next month we have energizing nutrition. How many of you guys think you could use maybe 20, 30, 40% more energy? How many of you guys think that would be a scary version of you if you did? Well, you'll have to come and find out. So it's going to be a great workshop. So that's coming up next month, March 11th. So mark your calendars. I believe you have a flyer in your hand out there. And I want to challenge your thinking tonight. I really do. I've been thinking about this and, what do we want to learn? What do we want to leave with tonight? Never want to walk out that door the same person you walked in. You're here because you want to see things change for the better, right? All right. So in order to change, you have to make better decisions. In order to make better decisions, you have to think better. So we're going to, kind of walk through our thinking process tonight as far as why we do what we do. And I know a lot of the answers, but I want to see if you do. So please forgive me in advance. I'm going to ask you lots of questions as we go through. Is that okay? Yeah. All right. And I do think that I have a video here just to start briefly and make sure we can get through this. My videos never work on the first shot, so that's good. They never work on the first shot. This is a MacBook thing. I'm not really sure why, but it's okay. I think it's okay. I hope it's okay. Hey! All right, one more time.
Heart disease. It's projected that 1 out of every 4 people in the United States will die from it. And more younger people are being diagnosed every day. We find out more in today's Health Matters. Age is only a number. That's how the old saying goes. And when it comes to heart disease, that's a fact.
This past month saw individual 27 with cardiovascular pain and blockage. And we see it in 90-year-olds.
As a cardiologist, Dr. Edward Palang warns heart disease can strike anyone at any stage of life, no matter how active they are.
Just because I'm 40 and I'm playing tennis and I'm active doesn't mean I can't have a cardiovascular problem.
While heart disease is often thought of as an older person's problem, Dr. Palang says young people need to be especially on guard.
There's a lot of denial.
Not going to happen to me. Famous last words. Very, very dangerous words. And what you're going to learn tonight is that, again, heart disease and heart attacks don't necessarily have to be age-dependent or age-related. As cardiologists see, a lot of young people are having cardiovascular incidents also. And you're going to understand why tonight. You're going to get the answer why. Because that the root cause of heart disease isn't necessarily a lack of a particular drug or prescription that you may or may not be on. And it's not necessarily a cumulative process that takes decades. It could happen very, very quickly, and you're going to find out why. So it's the #1 disease killer. Cancer kills a lot of people, but heart disease kills more. And there's 3 times more people dying now from heart disease than back in the 1930s. As years go on, we don't see less cases of this. We see what? We see more. Yeah. And yet, it's interesting because it's like almost everybody we know is on some kind of heart medication, right? Raise your hand if you know somebody on cholesterol medication. Keep your hands up if you know somebody who's on blood pressure medication. Keep your hands up if you know somebody who's on diabetes medication. It's like, so it's interesting because everybody's on these medications, and if that was the cure, if that was the answer, shouldn't we have less cases of heart disease? Well, we have more. But why don't more people ask questions and say, okay, well, this strategy is not working very well. Why don't we look elsewhere and do something else? We don't, because we trust our doctors. And we're, you know, when it comes to questioning their authority, a lot of us get nervous and anxious because we don't know how to engage in an intelligent conversation with them. Well, again, that's another one of my wishes and prayers that you do. Raise your hand if you want to be able to ask your doctor intelligent questions that could possibly save your life. Yeah, and many of you have, and that's what I love hearing. It's the people that keep coming back to the workshops every month. When that test pops up and the doctor shoves another prescription in your face, you have the answers and you have the confidence. And then what happens is when they see that, they back off. They take a step back. When you say no, they say, okay. You know why? Not because you're defiant or disobedient, because you gave them an intelligent question, which is referenced from the medical journals that they're supposed to be reading. And that's what we're going to cover here tonight. Lowering, you're going to learn here tonight, lowering cholesterol to very low levels does what? Not, everybody say that word? Not, doesn't reduce your risk of heart disease or early death. Everybody's taking cholesterol medication because they're scared that if they don't, they're going to have a heart attack. And what you're going to learn tonight is that's not true. So just because you lower your cholesterol levels all the way down, it doesn't necessarily remove your risk of a heart attack. In doing so, you're actually putting yourself at greater risk for other health complications. Big question I always get, well, I don't want to take my cholesterol drugs. What else can I do to lower my cholesterol? You're going to learn tonight that's may not necessarily be the right question to ask. We want to be asking different questions if we want different results, right? So let's go over some facts here about cholesterol. Do we need cholesterol in the body? Yes. Yeah, God doesn't make junk. If there's cholesterol in your body, there's a pretty good reason why it's there, right? Your brain holds 2% of the body's mass, but contains how much of the total cholesterol? 25%. The brain is made up of a lot of cholesterol, and you need that. If you want those neurons firing, if you want your brain firing on all cylinders, raise your hand if you think that's a good idea to have your brain firing on all cylinders. Say aye. Okay, yeah, so if you want that, you take cholesterol out of the picture, or you lower the cholesterol, you're compromising that normal function, number one. Number two, cholesterol forms the membranes of the cells. Every membrane of every cell in your brain and everywhere in your body is made up of what? Cholesterol. And that's what allows the cells to be functional, to let the nutrients come in, to let the toxins get out. Without that cholesterol, you're shutting that all down. Cholesterol serves in the brain as a powerful antioxidant. How many of you guys have heard of antioxidants before? What do you need antioxidants for? Mainly to anti-aging. What else? What's another disease killer? Cancer. That's right. So when you're shutting the cholesterol mechanism down, you're actually increasing your risk of what? Cancer. That's right. The lower you take your cholesterol levels, the higher your risk of cancer. So think about all the things you've done for the last 10, 20, 30 years at the recommendation and advice of your doctor, and look at some of the things that you've been challenged with. Some of the things that you've gone through, as could very well be related to some of these recommendations and some of these prescriptions that maybe you took from a well-intentioned doctor who had your best interest in mind, but really wasn't keeping up with what we're talking about right now. Again, when I tell you guys this is the difference between life and death, you understanding this or not, I'm not kidding. I take care of a lot of people that have been through hell and back because they don't know what we're talking about tonight. And we don't want that happening to anybody if we could prevent it. So what happens to all these benefits as a result of lowering your cholesterol? That's the question you should ask. That's the question you should ask. Do I want to lower my cholesterol with a statin or the supplement? That's the question. Is lowering your cholesterol the answer, whether it's with a drug or with a supplement? No, that's not the right question, and it's not the right answer. So we have to look beneath the surface at what's lurking here. The Canadian Medical Association Journal, a medical journal, they did a review, they did a study, and what they found was, historically, the American Heart Association recommended an LDL level. You guys have heard of the LDL and the HDL, right? What is the LDL? The good or the bad? Okay. So they wanted that, that LDL to be pretty low. Actually, 100 for prevention, but 70 for high-risk patients. People who are at risk for heart attack, cardiac patients who've already had episodes. The new LDL cholesterol was found to be what? The ideal? 126. Why? Because what did they find? The LDL of 107 was associated with a 33% increased risk of cancer. An LDL level of 87 was associated with a 50% increased risk. And as the LDL goes lower, the risk keeps getting worse and worse. So again, you know, when I see this happening with patients or relatives, you know, they're all excited about how low their LDL cholesterol is because their doctor wants that there. I'm like, that may be good for your doctor, but that's not good for you. You could get all excited about your LDL cholesterol, you know, being in an area where you think you're going to prevent a heart attack, but you're raising your risk, increasing your risk of what? Cancer. That's the bigger concern here. So, National Cancer Institute, 12,500 men and women. That's a small study. Not. Men with the lowest cholesterol levels were the most likely to get cancer. That's right. Statin medications, increased risk of death. Here's an Israeli study that came out more recently, American Journal of Cardiology. Again, prominent medical journals, which are accepted in mainstream medical profession. Researchers followed 300 adults over the course of 3 to 11 years, roundabout. And what they found was those who were taking statin drugs had the lowest levels of LDL, were found to have the highest rates of what? What is mortality? What does that mean? Early death. Highest rates of mortality. Conversely, the people with the higher levels of cholesterol had the lowest risk of death. Interesting, isn't it? Completely opposite. We don't look at this. We don't look at these. We just look at the things that the doctor wants us to do. He says, okay, so take this, do that, and we're not taking into consideration the big picture. Statins decrease brain function. So Dr. David Perlmutter, a prominent neurologist, wrote about this. He said neurons rely on the delivery of cholesterol from the bloodstream via what? LDL. So what is LDL? Does anybody know what LDL stands for? Low density lipoprotein. Very good. Do you hear the word cholesterol in that? Low density lipoprotein. Why don't you hear the word cholesterol in it? Because it's not cholesterol. It's a protein molecule that shuttles cholesterol, life-giving cholesterol, to the neuron in the brain. Interesting, isn't it? So it's something that's actually important. You don't want to wipe that out because then you're stopping the brain from getting the nutrients that it needs to perform critical functions. LDL is not cholesterol. It's a low-density lipoprotein. The fundamental role of LDL in the brain is to transport life-giving cholesterol to the neuron where it performs critically important functions. Neurons, cylinders, just like in your car, in your brain. Raise your hand if you want them firing on all cylinders. Yes, it's a good idea. So again, just think of this. The lower you're taking your LDL, the lower you're taking your cholesterol, the slower you're letting that motor turn. It's not firing on all cylinders. It's like having a V8 motor, turn on 2 cylinders. You're lucky if you can back out of the parking lot. And sadly enough, that's what happens with a lot of people who are on statin medications. They're calling up their loved ones when they get to Publix or Home Depot. How did I get here? Can you come pick me up? I can't find my way home. The brain is not firing on all cylinders. Makes sense, doesn't it? Okay, so what do you want to do to take your cholesterol down naturally?
You don't want to do that.
Good, that was almost a trick question. That means you guys are getting it. Very good, excellent, excellent. Okay. Good job. You picked a good one here, Jim. I'm telling you. Awesome.
Married up.
You married? Yeah. All right. So you guys got it, right?
Yep.
So you don't necessarily want to take your cholesterol down. There's something else which is going to put an individual at risk for a heart attack or cardiovascular disease other than cholesterol. It's not cholesterol in and of itself. It's something else here, and that's what you're going to find out. Okay, one more, just to beat a dead horse here. Framingham study, there was 1,900 participants out of Boston University. And what they found was they did all the testing with people who, they were evaluating learning, memory, concept formation, concentration, all these things that were compromised with Alzheimer's disease. And they found the people with the total cholesterol less than 200 performed the least well on the cognitive tests, and the people at the highest cholesterol levels scored the highest on cognitive tests. So when you look at your overall total cholesterol, remember when the doctor looks at the cholesterol, they're going to look at the blood test. And when you see those markers and you see it bold and it's like there's an arrow up there, and then they circle it and they say this is not good, remember what I'm telling you now. Your cholesterol may be over 200, it could be over 230, it could be over 250. But the doctor could be concerned, but you have to remember what we're talking about now. Is it necessarily a risk factor if your cholesterol all by itself is high? No, not in and of itself. There are other factors in your blood test that you need to look for, but cholesterol in and of itself is not the factor. Last time I had my cholesterol measured, it was 230, 234, something of that nature. But again, I know there's a purpose for that, and your body very often makes more cholesterol if there's deterioration, if there's healing that's necessary. If your body's making new healthy cells, remember, the cell membrane is made up of what? Cholesterol. So if a person's cholesterol levels are abnormally high, it could mean that they're either fighting something or regenerating new tissue or healing in some sort of healing process. There could be a reason for that also. It could be part of the healing process for that individual, actually. Doesn't that make sense? There's a reason for everything. Remember what we said earlier, God doesn't make junk. There's a purpose for everything in your body. And if you go in there and you're always just going to biohack and try to make the body do what you want it to do, there's always a repercussion. There's always a price to be paid. Parkinson's disease, people with the lowest LDL cholesterol were increased risk for Parkinson's disease by how much? 350%. That's no joke. And you see all these things, and you know, where were they 20, 30, 40 years ago? Did we have all these cases of Alzheimer's disease, you know, dementia? You know, it's like I told the story of my mother-in-law, and you know, I can't believe how many people are dealing with this with their parents. And even sometimes, you know, people in their 70s now, I know, are dealing with this with their children. I just heard of there's the lady, I don't know, she's probably close to 80. She's got a daughter that's 60 who was just diagnosed with Alzheimer's, and the younger daughter behind her, at 55 years old, is starting to have early signs of it as well. All right, so if you're over the age of 85, you have 1 out of 2 chance of having Alzheimer's diagnosis. If your age is 65, if you're over 65, it's 1 out of 9 right now. And these odds are progressively worsening. So this is all part of why. You know, I talked to you guys about toxicity, I talked to you guys about sugar and this and that, but the drugs are a big part of this. You got that? The drugs are a big part of this. So I don't want to stand here and tell you to stop taking your medication, but I do want to tell you is that if you don't have plans to somehow do something else instead, so that at some point you could start taking less of that, I don't want to sugarcoat this, but it's not good. It's not good. When I look at a drug epidemic in this country, and I see school shootings, you know, we got the 1-year anniversary of this thing coming up. Somebody mentioned it. Yeah, we were talking earlier. As soon as you said that, I was like, yeah, there's evil in this world. There's evil in this world. But then I said to myself, part of that evil is the psychotropic medication that these kids are on, that make them do these things. And that's part of pharmakia. And pharmakia is part of the whole thing where everybody has been born into a medicine chest. To think that, you know, we worship at the altar of modern medicine and that is the standard, the be-all, end-all, whatever our doctor says. And what you got to realize is that when they evaluate our healthcare system, we get an F on our report card every single time. F! F! So if you go to a school and you're learning from a teacher that's constantly having their students flunk out, do you want your family, your children, your grandchildren to go to that school? Heck no. But that's what we're doing. That's what we're doing. Your doctors are good people. I know you have insurance. I know you go because you want to get your regular tests, and there's nothing wrong for doing that. But you have to understand there's got to be application here. So when you leave here tonight, take this stuff with you and apply it. Have a long-term strategy. You know, if you are taking some of these medications, you want to be asking yourself, are there other things that I can do that'll make my body strong enough to where they may not be necessary? Because right now, without that, they're very well may be necessary, right? If you're not doing anything else instead and your body is weak and you're on that stuff, you can't just yank the rug out. But you got to build your body up. You got to start doing all of these important things, which modulate the genes, which shut those diseases off. It makes sense, doesn't it? And that's what we're trying to look into here. Yeah, but is there such a thing as dangerously high cholesterol? And what you're going to see is, I'm going to show you a study here. There's just as many people that have heart attacks with low cholesterol as with high cholesterol. Isn't that interesting? Cholesterol is an extremely poor predictor of a heart attack risk. There's something else that you need to look for in a blood test which will tell you whether or not you're at risk for a heart attack, and it's not cholesterol. Journal of the American Medical Association, 1994, 1,000 participants. They did a study at Yale University. Here's what they found. People with low total cholesterol have what? Just as many heart attacks. That's what the statistics showed. So where do they get the nerve to put so many people on cholesterol medication? Where do they get the nerve to do that? Well, it's easy for the drug companies to just come along and create their own little study and say, oh, well, it decreases levels of inflammation so that we're going to actually have this outcome here, and that supports the necessity for everybody taking it. And that's what they do. And then they publish that and they say, okay, well, we're going to use this as the standard instead of this. I don't know if anybody here works in a hospital. At one time you did, remember, right? So you look in people in the ICU, those who just had a heart attack, myocardial infarction, and you look at their health profile, you look at the number of medications that they're on, and what are they all on? Statins and high blood pressure meds. So it's interesting, right? So that we don't question that. Like why if this stuff worked and it really did prevent heart attacks and that was really true what they're publishing, then they shouldn't be on any medication, right? So now we're getting the facts here. The New England Journal of Medicine published this in 2005, and here's what they found to be the accurate predictor of a heart attack. It's called something called inflammation. Inflammation. Your inflammatory markers in a blood test can be identified with something called HSCRP. HSCRP. Just remember, C-reactive protein. And a normal blood panel, like when you go for your annual, it's not going to be in there. It's not going to be in there unless you specifically ask for it. And everybody brings me their blood test results, and it's never in there. So doctors aren't looking for this. They're just looking at your cholesterol level, and they're going to put you on a statin drug. So the New England Journal of Medicine, they published this. They found with the patients with the low CRP levels had fewer heart attacks no matter what. No matter where their LDL cholesterol was. Didn't matter. And they had more heart attacks if their CRP was elevated regardless of their LDL levels. So it doesn't matter. You could be running a 300 cholesterol. Your LDL could be off the charts. But if your CRP is below 3, you're good. That's what they published in this medical journal. And this is where we should be concerned with. How inflamed is your body? How inflamed is your body? How much inflammation do you have going on in your body? Does anybody know that? Is there anybody sitting here who actually knows what their CRP levels are? You do? Good. Where are you at? That's awesome. Where are you at? 2. Okay. Yeah. Less than 1. Wow. So you guys are all taking supplements because you've been on, you've known this for a while and you're working on it. You're actively working on it. And you're not just guessing, you're testing. And you know what's great about that? Because everybody can take supplements. There's nothing wrong with that. But how do you really know if they're working or not? Especially with a condition, inflammation, which is not just at the root cause of heart attacks, but also it drives cancer. And it's at the root cause of every degenerative disease. This would really be one of the most important tests that you could actually look at to determine which way you're moving toward that disease developing, getting worse, or away from it. So we have these tests that now we have actually a test kit that we can run in the office. It's a pinprick, it's a blood spot, and we package it up, we send it off to the lab, we get the lab results in 5 to 7 days, and you can sit down and you can see where your CRP levels are, and then you'll know whether or not you really need to megadose with anti-inflammatory supplements or nutrition. So that's what you really need to work on. And you need to look into that if you have a concern, especially if you're taking cholesterol medication or any other kind of heart medication, which we know has serious side effects. One of them being low testosterone. If you're a man and you're taking cholesterol drugs, causes erectile dysfunction. This was published in the Journal of Family Practice. Lab reports repeatedly demonstrate those on statins are what? Twice as likely to have low testosterone levels. And guess what? This is a multi-billion-dollar industry. Erectile dysfunction, testosterone clinics, Viagra, right? And where do you think a lot of this comes from? It's driven by the side effects from other drugs that we've been prescribed. Wow, interesting, isn't it? Yeah, very profitable industry, the drug industry. They're not dummies. You know, it's called disease mongering. They create diseases out of perfectly normal people sometimes when you put them on medications that can actually, you can avoid that to begin with. But this is very often what happens when we don't ask questions or we live sedentary lifestyles. We don't take care of ourselves. Cholesterol is a precursor for what? Hormones. How many of you guys know, like, people that have a hormonal imbalance? They take bioidenticals, or you guys know when your hormones are off. How do you feel? Dopey. Yeah, really bad. It happens sometimes. For some people, it happens like 24/7, 365. It just doesn't stop. And once they're out of whack and out of balance, it's hard to get back. But when we help people balance their hormones, one of the things that's at the root of this is cholesterol medications. I always see that in the profile of people who are out of whack with their weight, they're on antidepressants, and they're usually on cholesterol medications. And that's the number one disruptor that we see, because that's at the root of synthesizing some of the hormones or all of them. What do you think? All of them, yes. So, prescription drug side effects, calcium channel blockers cause a 26% increase in risk of having a heart attack or heart failure. Some of you guys are on this: Cardizem, Procardia, Tyzac, Norvasc. 48% increased risk of diabetes among women taking statin medications. And these are medical journals, you guys. So metformin increases your risk of your chance of dying from cardiovascular problems by how much? 250%. Yeah. So this is what's been called the medical merry-go-round. You take one medication, you get a side effect, and for that side effect you have to take another medication, and then you take another medication for that side effect, and you wind up with the same problem that you started with in the first place. So that's just part of it. And then you have blood pressure medication side effects, which you guys already know. Also affects your libido, decreases sex drive, headache, fatigue, insomnia, anxiety. You see, it's very, very common. But who would have guessed it causes cancer? Blood pressure medications causes cancer. And I don't know if you guys have been watching in the news, but this was in July. I talked about this. Valsartan, they recalled because it was causing what? Cancer. And then a few months later, losartan was recalled because it was causing cancer. And now, last month, the fourth blood pressure medication that they just recalled because it was causing what? Cancer. Wow. How about that? I believe some of these were the blockbuster drugs that you saw in the 6 o'clock news. Wonder drugs. Yeah. And then what happens? They sell enough of it, make billions of dollars in profit. This comes out, and they get a slap on the wrist. So if this goes to court and they have to pay $1 billion in fines, does that put them out of business? No. But who knows how many people died because of this? Yeah. And that's why we're talking about this right now. So it's not you or any of your loved ones. So what's normal blood pressure? Well, if you look on the Mayo Clinic website, they constantly are redoing these revisions. And some doctors will say 150 over 90, especially if you're over 60. This is what they look at. Some physicians say 100 plus your age should be your systolic, right? So it's very, very common for your blood pressure to go up as you get older. Why? The arteries are not as elastic, and we still got to get the oxygen, the nutrients to the distal parts of the body, so of course your blood pressure has to go up to accommodate for the inflexibility of the arteries. So that's normal as you get older for your blood pressure to what? To go up. So you start taking your blood pressure down. If you're in your 60s, 70s, you start taking your blood pressure down to the level of somebody who's in their 30s. Of course you're going to slow down. Everything's going to slow down. It's going to age you very, very quickly. A lot of these medications will do that. And I see this happen so quickly sometimes. I have patients that are vibrant, they're energetic, they're on no medications at all, and then something happens, they'll go to their doctor and they'll see a level off, and the doctor puts them on 2 or 3 medications just like that. And what do you think happens to their whole countenance, their energy levels? In the toilet. It's like black and white. And it takes me to shake them by the shoulders and say, hello, do you see what's happening? This is the beginning of the end. Okay? Again, I don't sugarcoat it, because when I talk to you guys, it's like me talking to my mom or my dad. Like, wake up! Wake up! Okay? This is the beginning of the end. I've seen this way too many times. And these medications will kill you faster than they help you. This is reality, you know? So the conversation has to go something like this. Okay, so they give you medication for your blood pressure, they give you medication for your heart, you're on metoprolol, you're on all these things, you know. How about a brisk walk in the morning? I don't know. Well, okay, what's the alternative? Stay on the medications and die early. All right, get up 15 minutes earlier and just do a brisk walk every single day. What do you think that'll do for your blood pressure? It'll bring it down. It'll stabilize it. Maybe you could go back to the doctor and they could start winding you down on this stuff. Like, start taking control of your health. Don't let your doctor or the drug companies take control of your health in your life. You start taking control. We can't. The minute we outsource the responsibility for our health to our doctors or somebody else, that's the beginning of the end. So this is what I'm seeing. I just saw it with one of my patients. I have a patient who's been under my care for 24 years. I've been in practice for 25 years, just to give you an idea, okay? So he's never been on any medications. And this is who I'm talking about right now. Just think, if it can happen to a veteran chiropractic patient that's been under my care that long, can it happen to anybody in here? Yeah, it can. And so we're all smart enough, we're all strong enough to do the right thing when we stop and think about it. There's always change that's available. You can always choose to do something better. There's another thing that causes high blood pressure. I talked about this, I think, at the toxicity workshop. Now, this was published in the Journal of the American Heart Association. They're now realizing that a lot of drug-resistant hypertension is due to lead toxicity. Lead gets stored in your bones. Low-level lead and heavy metal exposure will drive your blood pressure. As my aunt, she lives near Flint, Michigan. And she's, my dad was just telling me this a couple of weeks ago, that they can't get her blood pressure down. She's on 3 different blood pressure medications, and it's still running at like 190 over 100. And she lives like right near Flint. Hello? Wow. Yeah. And no sooner did this study just come out than recognizing it. So when you have hormonal changes, or when you go through puberty, or women go through pregnancy, or hormonal changes, your body releases the lead, and that's when things go from bad to worse. So that's why looking into a daily gentle detox is so important for your overall health, not just your blood pressure. We talk about that all the time. Most important modifiable risk factors related to heart attack risk include smoking, don't smoke, right? Excess alcohol consumption, lack of aerobic exercise, overweight, and a diet high in what? Carbs. Like, everybody knows don't smoke, don't drink, right? Exercise. But nobody gives a whole lot of thought to the high in carbohydrates thing. And that's, I'm telling you right now, single-handedly, like, if you could wrap your mind around this and like take some action, you'll see better results than if you did exercise. Just even without exercise. Some of you guys have seen how powerful it is when you just cut out the carbs. What happens with your blood pressure, your cholesterol, your blood sugar immediately comes into normal range. It's powerful, guys. I'm giving you the keys to the kingdom right here. Fat facts. Losing 10 pounds doubles your chances of normalizing your blood pressure. 22-pound weight loss reduces your risk of heart attack by what? 75%. That's no joke. That's a big return on investment. So many of you guys know that we have a weight loss program here. I don't want to talk about it or get into it. If you have any questions, talk to Deborah, but we have a supervised 40-day program that'll help you lose anywhere from 15 to 30 pounds. But if it's something that you need help with, and help you, walk through that process, we do. We have something like that. You just ask Deborah and she can help you. So let's take a mental break very, very quickly. Can I have my wonderful, dynamic, awesome staff come on up? Everybody give them a round of applause. Woo-hoo! All right, I want to recognize some wonderful, wonderful people here. First and foremost, for a perfect adjustment schedule. We love when you stay on track with your adjustments, with your schedule. We love to see results. We love to see healing. We celebrate that, and so we want to recognize that. And so when I call your name, please stand up so we can recognize you for perfect adjustment attendance. Sandra Moline, stand up. Let's go crown her the Medal of Honor. Well done, well done. Got some amazing changes. Amazing. Thank you. Yes. Awesome, awesome. All right, and so we have one more. Where's Vanna White? Where's Vanna White? Yeah! It's not the same if you don't do the Vanna White. All right, so this is Core 4 University degree coming to 6 or more workshops. Ingrid Chen. Everybody give her a big round of applause. Good job. That's pretty good. So what is that? 6 workshops inside of 7 months or 8 months you've been a patient? How about that? 6 workshops inside of 7, like not you haven't missed one since you started care here.
I missed one.
Missed one? Okay. All right, we'll give you that. That's okay. We still love you. Awesome. All right. Well, let's just stand up briefly and turn and face the person on your right and put your hands on their shoulders. Give them some love. Get that stress out. I'm gonna keep you guys awake here. You're doing such a good job. Is anybody learning anything tonight? All right, karate chop. Go ahead. Karate chiropractic. Karate chiropractic. I gotta fix what your husband broke earlier today. All right, turn around and love your other neighbor. Get that stress out. Massage. Very good. Awesome. All right, karate chop.
Yes.
Karate choke. All right, give yourself a round of applause. Heads up, coming out, hot and heavy. Heads up, quick. Woo! Yeah! Whoa! Taking my ceiling out. Fire sprinklers going down. All right. Show goes on. Stay with me. All right, so the question is, does cholesterol cause coronary artery disease? Can your arteries clog up? How many of you guys have a mental image of an artery clogging up and choking the life out of you? So here's what happens. The artery clogging up has more to do with oxidized cholesterol than it does with cholesterol. So if cholesterol is supposed to be there, something can physically modify the cholesterol to cause a problem. And what would that be? Sugar, yes. What does sugar cause? A rusting process. Sugar is like if you ever seen an apple, if you left it out and it turns brown, that's oxidation. And when that happens, then you have a process of inflammation. Inflammation inside the arteries is what could swell it shut, not necessarily the cholesterol. So the cholesterol becomes physically deformed because of the sugar. And that's what drives the inflammation. Does that make sense? That's why the CRP levels are so important. That's why the HSCRP levels in your blood are so important, because this can tell you whether or not that's actually happening and you're at risk for arteries closing up and clogging up. So now do you understand why that's more important to look at than the actual cholesterol numbers that the doctor puts the emphasis on? HSCRP is where it's at. So if you look at the top, can everybody see the arrow on the top right? Yeah. So what's that pointing to? An artery that's fat and wide open. Fat and wide open. No blood pressure problems, no atherosclerosis, no inflammation. This is a person that could quite possibly have a 300-400 level cholesterol and absolutely no risk for heart attack. Is that possible? Yes. Because cholesterol is normally and naturally occurring in your body at whatever level is proper for that person. As long as there's no inflammation. If that person is eating proteins, fruits, and vegetables, has an anti-inflammatory diet, anti-inflammatory nutrition, they could have a 300, 400 level cholesterol, and that's what their arteries could look like. I'd be okay with that. If my cholesterol was 300 and I know that I'm doing what I'm supposed to be doing, I'm not worried. And that's what our mindset should be. If there's a concern, you need to look at something like this. Is there inflammation in the arteries? If there is, and you're taking cholesterol medication, then you should still be concerned. Because will the cholesterol medication reduce that swelling in the arteries if you're eating a diet high in carbohydrates, right? High fructose corn syrup, grains, sugar, because that's what's driving the inflammation there. That's what's setting on fire the cholesterol to clog up your artery. Not the cholesterol in and of itself, but the sugar. That's what that's causing. So if you're on cholesterol medication and you still are going crazy on the sugar, that's what's happening. You don't have peace of mind if you have high inflammatory markers and you're on cholesterol meds, even blood pressure meds. Because eventually, if it continues to get worse, if the lifestyle issue is not ever addressed, you could be on blood pressure and cholesterol meds, and you still wind up in the ER with a what? Heart attack. And that's what they see. People who work in hospitals, nurses, doctors, room full of, critical care people who have just had heart attacks on the standard heart medications because they don't address the sugar, they don't address the carbohydrates, they don't address the lifestyle issues, the anti-inflammatory component of this. If you want to prevent heart disease, heart attack, stroke, diabetes, every degenerative disease comes down to the sugar. Make sense? Okay, so this is what it is. It's a love-hate relationship. We love it, but we hate it. We love it because it tastes good, and then we hate it because we feel horrible after we've eaten it, and then we feel even worse when we get our blood results at our annual checkup. We love it because it tastes good. We've been conditioned. We've actually been programmed. We've programmed our brain. It's it's actually no different than an addiction to a drug. You get the same hit of endorphin that you do when you drink a soda as you do when you do a line of cocaine. It's the same exact thing. When they've done MRIs on people, they show the same part of the brain lights up as people who do cocaine and heroin or any of these sugary drinks or Pop-Tarts or whatever it is. It's the same operant conditioning and the physical conditioning in your brain. It's an addiction. Sugar's an addiction. You know that, right? Yeah. Okay. Can the addiction be broken? Of course. Is it easy? No, like the first 2-3 days, it's hard. Once you get past day 3, you don't even think about it. How many of you guys have ever done that before? Look at the hands up, guys. Look at the hands. A good 30-40% of people. Once you get past day 3, you're home free. And then you're on your way to healing and serious results. So I just want to encourage you. Look at it. We all know it. It's our poison. But you can do something about it. For most of you in here, you might be far enough along to where you can have, your spaghetti meatballs one day a week. You can have a couple slices of pizza one day a week. But for I would say the majority of us here who want to see changes with your health, how many of you guys want to see changes with your health? You're here for results, right? What I would recommend is avoiding this, avoid it 6 out of the 7 days a week. Give yourself a cheat day to enjoy that and reset your metabolism, but not a license to go back and start doing it a second day or a third day or a fourth day. You got to keep it on the rails, otherwise it just comes undone all over again. And if you can't, then just stay away from it altogether. You won't die. Eating just fruits and vegetables and meat, you won't die. It's okay. You get your carbs from fruits and veggies. It's okay. So once you stop with this and you see your body just automatically, easily unload 20 pounds, you'll never go back. You won't go back. You just wake up in the morning every single day, your stomach is flat. You don't get bloating, belching, indigestion. You don't feel like you got punched in the gut or you have a basketball in there when you push yourself away from the table. A lot of that comes from mixing your carbohydrates with your proteins. So try it. You'll see a big difference. By the way, you see the corn head there? Cute little picture. But I want to bring this to your attention because a lot of people don't know that corn is a grain. We think corn's a vegetable. Oh, how cute, it's mixed in there with the medley. No, Don't touch it. Don't touch it with a 10-foot pole. You know why? Where does glyphosate, the active ingredient in Roundup, where does that get targeted? Toward what? Corn and soy. What does glyphosate do? Besides it kills the weeds, okay, we know that glyphosate is not good. It opens up the blood-brain barrier and increases your risk of senile dementia and Alzheimer's disease. If you're not eating non-GMO food, you're in for it. All right? The statistics that I talked about before with Alzheimer's, think of that when you see corn and soy. Okay? Besides that, start getting all non-GMO stuff. Anything that's genetically modified has been altered to withstand and not die with the application of glyphosate, with the application of pesticides. How could that be good if it's going into your body? That doesn't come out. It goes straight to your brain. So just look at that corn and realize we're done with that. It's time to stop. Stop that. Unless you're getting, non-GMO, even then it's a grain, and we're talking about stopping with the grains because what do grains do for inflammation? Make it better or worse? Makes it worse, yeah. So you guys are trying to get some help here. I'm telling you, this is, corn's not a vegetable. It's not a vegetable. So it goes with all these other things. Of course, it goes without saying anything that's white, bleached, flour enriched.
Processed.
Yeah, processed. NG, no good, no good. All right, so hopefully a picture tells 1,000 words. You can see over here all of the grains, even some of them healthy. It's like you got the brown bread, whole wheat bread, rye bread. Some of these that would be considered more healthy than others, but in the end, they're grains. In the end, they still drive your blood sugar. They still drive inflammation. They still put you in fat storing instead of fat burning, right? So why do any of it at all? Because eventually, if you're driving inflammation, what are you doing to the blood vessels? Shutting them down. Yeah. And if you want to reduce or get off these medications, you need those blood vessels open, or you don't have an excuse to get off of them. You have to stay on them until you go from here to here. And what's the only way to do that? Is by making that lateral transition, that lateral move. It's not an up or a down. It's instead of this, you do this. Instead of this, you do that. Very simple. Proteins, fruits, and vegetables. Eggs, great source of protein, almost nature's perfect food. Salmon, even meats, if they're grass-fed, still a better choice than a lot of the other things that we're talking about. And good healthy fats. So what does that look like on a daily basis? Typical day in the life of Dr. Yachter. I start my day with a shake after I work out, and my shake has lots of protein in it, moderate around, very few carbs. Most of the carbs that I get, if not all of them, are from the berries. I didn't have strawberries this morning. I had raspberries, blackberries, and blueberries, and then a tablespoon and a half of almond butter. And if I eat that, my blood sugar is stable, and I'm good probably for the next 3 hours. And that's after a ferocious workout. I don't really fill myself up. And I'm not hungry, though, for the next 3 hours. Why? Because I have lots of what? Fat. So you got to have that fat in every meal. And that fat is also actually anti-inflammatory. The fat is actually what? Anti-inflammatory. Very good. I know a lot of people who just leave this part out of the equation. This is very, very important, guys. Because you could have a salad for lunch, and you could have your chicken, and you could have all your your veggies on there, your lettuce, but you don't put olive oil on. Maybe you'll put Thousand Island dressing or something like that. And it's saturated. It's not saturated. It's the bad fats. It's trans fats. Yeah. So anytime you're gonna have a salad, you want to make sure you have a good fat. One of my favorites. I had this today. Salmon Caesar salad. So you got good healthy fat in the what? Salmon? Yeah. And then on top of that, you can drizzle a little extra virgin olive oil. If you don't have salmon, you could have chicken, extra virgin olive oil. If you don't have that, you could do a Greek salad, extra virgin olive oil. What's so important about the extra virgin olive oil? Good fat, anti-inflammatory, right? What else is good to put on your salad? Avocado. Avocado, nature's almost perfect food. Avocado is amazing. It's got more potassium than a banana. Yeah, avocado a day will keep the doctor away, especially with your heart. So think about these things. The thing I want to emphasize is the fat. You don't see carbs in there. Oftentimes we'll get up from the table, well, yeah, I don't feel full. I gotta eat more bread. I have to have more rice. I can't not eat carbs. I gotta fill up. No, you can't. You don't have to fill up to be satiated. You know what satiated means, right? It's satisfied. The fat has greater satiety value than the carbs and will keep you not being hungry longer. The carbohydrates will leave you hungry faster, and you'll feel horrible when you get up from that table because you're all bloated. So, and not only that, you're going into fat storing instead of fat burning. If you have the good fat, it'll help your body burn fat, and it's good for your brain too. So dinner, you guys have seen this, lamb chops and broccoli, chicken and asparagus, fish. There's a vegetable medley, a little bit of rice there. That would be my dinner on a Friday night. If I have a little bit of rice, I like to reset my metabolism with a little bit of grains once a week. That's what I do. Now, again, some of you guys maybe can do that. Maybe for some of you it's not a good idea. I'm just giving you some ideas. Does that make sense? Okay. What do I like to put on my meat? What do I like to put on all my veggies? I'll put extra virgin olive oil on my veggies, but I like to have a lot of butter also. Butter is another good healthy fat. Butter, coconut oil. These are also very, very healthy. You know what I wanted to do? I wanted to show you this the shake that I have in the morning. Many of you in the room have started to do the shakes. You know, I got to tell you, this is the breakfast of champions because many of you are looking for supplement recommendations. You don't want to fill up in the morning. You're not sure what to eat. You don't want to get yourself in trouble making a bad decision. The easiest, safest, most sensible, economic thing that you could do is just have the shake. And this, the Ultraplex Complete Clean, I have really grown to love this even more than the Metaclear. I love the Metaclear, but this really has a little bit more bang for the buck when it comes to the green tea, which is fat burning. It's also anti-inflammatory. Watercress, also detoxification. The N-acetylcysteine also has 3 times more of that, which is a major component for the daily detox more than the Metaclear. Turmeric, which is anti-inflammatory. Curcumin, which is what we've been talking about. 26 grams of protein. That's a good amount of protein. And it's a very vegetarian-based type of protein. And then there's 18 grams of carbs, but only 5 grams of sugar. So it's low in what? Sugar, yes. And then we got the fat, 9 grams. And so it's good fat. 2.5 grams of saturated fat. The rest is monounsaturated fat, like the same type that you would find in olive oil. So that's why I like to have this. The side of the profile on that, it really hits on a lot of the things making application with trying to improve upon some of the issues that we're dealing with here. Take 2 scoops. You can put it in water, you can put it in coconut milk, you can put it in almond milk, and then with that you can have some berries, you can have some almond butter, and that's what I do every single day, even when I travel. Even when I travel, I take it with me. Makes life really simple. So remember to replace the bad fats with what? Good. Be very, very careful of the hydrogenated fats because they drive inflammation. What do hydrogenated fats drive? Inflammation. They're just as bad as sugar. And toxins, the same thing. They're just as bad as sugar in terms of driving inflammation and shutting down the arteries, causing heart attacks. So cottonseed oil, soybean oil, and what's that third one? Vegetable oil. Really, vegetable oil? What, doesn't that sound healthy? It's a vegetable. Sorry. Look for it on the label. Corn oil, canola oil, and you know, you're going to find that in basically anything that is boxed or packaged. They do that to extend shelf life. And remember, the longer the shelf life, the shorter yours. Extra virgin olive oil. So these are the good fats. We want to get rid of the bad, put the good ones in. Extra virgin olive oil, avocados we talked about, coconut oil, raw seeds and nuts, almonds. I mean, I do very well with almonds. I could eat almonds and really shape up really quick. Walnuts are good too. Real grass-fed butter. So if you go to Publix, you can get Kerrygold. Kerrygold is really easy to get. But just getting grass-fed, whatever you can, buy grass-fed. Pay the extra money and get the grass-fed. You know, again, because otherwise you're getting it with hormones and pesticides, and they feed the cows grain. You know, your inflammation levels are going up if you don't buy grass-fed meats. You could be taking all these supplements, and you're defeating the whole purpose if you don't buy grass-fed, right? They feed the chickens with grain. Now they feed fish with grain. And again, you're down the food chain. Where do you think all this is going? That's what affects our blood pressure. All right, so talk about saturated fats really quick. Every cell in your body, 50% of the cell membrane is made up of what? Saturated fat. It is the preferred source of fuel for your heart, right? So your heart's beating, it's contracting, it's pumping, it's a muscle. Muscles need fuel, right? What's the best source of fuel for your heart? Saturated fat. What did they tell you to be careful of? Don't have too much saturated fat. Could that be part of the reason why we have 3 times more heart attacks and heart disease than we did in the 1930s? Look at the recommendations that we were given nutritionally over the last 40 years. A diet high in carbohydrates, right? 60% carbs, and low in fat. But it's interesting. Here's what the 23-year study found. 340,000 people. They followed them. What they found is the intake of saturated fat was not associated. Everybody say that? Not associated with an increased risk of coronary heart disease, stroke, or cardiovascular disease. So your intake of saturated fat, you're eating bacon and eggs, porterhouse steak, if it's loaded with saturated fat, doesn't necessarily associate with a higher risk of heart disease. The actual risk for heart disease was 19% lower in the group consuming the highest amount of saturated fats. Wow, isn't that interesting? How many of you guys have been worried about eating eggs because they're too high in cholesterol? How many of you guys were told that? Did you ever hear that? Stay away from the eggs, don't eat too much meat. Foods that are too high in cholesterol will raise your cholesterol. You know what, they tried that with President Eisenhower. His cardiologist tried to remove all those foods with the highest cholesterol in it, and he still kept having heart attacks, one after the other. It didn't matter. So that's not it. That's not where it's at. Your dietary cholesterol does not impact your blood cholesterol. That's what these studies are showing. So why do I say that? Do you like bacon and eggs and porterhouse steak? I do too. But again, you want to go cage-free, organic, grass-fed, and you'll have less to worry about there. Are you with me, Joy? Joy, joy, joy. Good. All right. So let's talk about some supplements, and some of you guys may need this. There's you ever hear of people who take nitrous pills for their heart? Okay. So there's a precursor which is called L-arginine. It's an amino acid, which basically is what's necessary for that nitric oxide production inside the muscles. And what it does is it causes the smooth muscle contraction inside the artery. So inside the artery, you have a big wide open artery, but the walls have muscle in them. And when the muscle contracts, it pulls the tissue closer to the wall and actually opens up the artery. So by taking L-arginine, that precursor for nitric oxide, you can cause the smooth muscle to open up the blood vessel. And what does that do to your blood pressure if you can open up that vessel a little bit? It'll help to possibly bring it down. Yes, if there's not a lot of inflammation, either way it's going to help. But this is one of the supplements. The UltraPlex Cardio will actually do that. And that's something that will help with heart health, supports circulatory health, helps with muscle strength and muscle support. Vitamin D. I've talked to you previously about how important vitamin D is for your what? Well, like everybody got that in elementary school, the bone health, right? All right, but what does studies show now more recently? What have you learned? Okay, brain. How about immune system? How about immune system? Prevention of cancer? What about vitamin D being related to cardiovascular health? Have you heard of that? Lots of studies. Yeah. Johns Hopkins published a study recently, and they found a correlation with people who have very low vitamin D levels and the highest risk of heart disease. Now, why is that important? Because vitamin D is a hormone in your body that regulates and modulates over 200 genes. Does that sound pretty important? Remember, when it comes to genetics, it's not what runs in your family line, it's what you're doing to turn these genes on or turn them off. Yes?
Vitamin D versus vitamin D3, there's like a big hoopla over D3. Is this like, does it really make a difference?
Does not, no, I don't want to go there. It doesn't necessarily make a difference. No, what we need to be looking at is for a good vitamin D supplement to be getting somewhere between 5 and 10,000 international units. Why? Well, because even though we live in Florida, who spends, time out in the sun? Very few people. If you do, if you're out there for a good 15 minutes, then maybe your body's making 5,000 international units. If you have darker skin, your body has something called melanin, which blocks, to a certain degree, your body's production of vitamin D. And then we wear sunscreen. And what does that do to your body's production? It blocks it even more, right? And then if you're overweight, the fat cells in your body actually soak up the vitamin D. So there's a lot of reasons why we should be considering taking a vitamin D supplement on a daily basis. Not just for bone health, but more importantly for preventing cancer, preventing infections, and preventing heart disease. So there's a lot of research on this that's emerging now, and that's why I've decided to include this with the supplement suite. You should be taking one of these every single day, at least 5,000 international units, to make sure that you're keeping your vitamin D levels high enough. Now, by the way, the kit that we have that I showed you that tests for the CRP also has a vitamin D test in it as well. It'll tell you what your vitamin D levels are and tell you how much, if you need to do more than 5 to 10,000 international units. So does that make sense, everybody? How many of you heard of CoQ10? Why is CoQ10 important? It's a necessary molecule for muscle function, particularly heart function, right? Now, what happens when you're on cholesterol lowering medication? What does it do to the CoQ10? It strips it out. And so the CoQ10, that molecule is important for muscle contraction. What's some of the most common side effects? 25% of the people that did a study one time quit their statin medications because of what symptoms? Muscle and joint pain. You guys know that, right? That's like the number one side effect. Yeah. But when they did a trial study and they introduced CoQ10 with people taking statins, 75% of the people who took that had no more muscle pain. What does that tell you? Clearly, that the CoQ10 is stripped out by the cholesterol medication, but if you take a CoQ10 supplement, the ubiquinol in there, it will help that if you plan on keeping on your statin medications, which of course I've given you plenty of reasons to not, but whether you do or you don't, studies have shown that this supports muscle function, it supports normal heart function, there are significant benefits for your body and your brain, and it promotes normal cardiovascular function. If you have a cardiologist that has you on statin medication and does not have you on a CoQ10 supplement, that's a big surprise. You should be seriously concerned about that. Most cardiologists these days, they know them. And every once in a while I'll find a patient who they're taking statins and they're not taking a CoQ supplement. Whether you're on statins or not, this is a major player with heart health. And that's why I have it in here also. EPA and DHA, fish oils, very, very important for blood pressure, normal heart rate, prevents arrhythmias, promotes growth of new blood vessels. Something called angiogenesis. What does that mean? The creation of new blood vessels. If you've got blockage in any vessels in your circulatory system, your body is intelligently designed. What does that mean? It knows when to make new blood vessels. If you damage the old ones, it's a little bit smarter than we think. So it starts making new ones. And even though you got complete 100% blockage of these blood vessels, your body will find a way to get circulation, the blood, the nutrients to other parts of your body. Your doctors don't really tell you about that. Oh, you got 95% blockage in your arm. You are this close to death. You know what? You'll never know. They were only looking at that one. They didn't look at all the other blood vessels that your body intelligently made that would have kept you alive if that doctor never checked you. Quite possibly. That's called angiogenesis. Fish oil capsules help promote that, as CoQ10 does as well. Prevents blood clots, counteracts what? Inflammation. Yes, very, very important. So there you have it. That's why these were selected. Obviously, if you're taking all of these, you're giving your body significant support in terms of cardiovascular health, and you're giving yourself a significant advantage if you're trying to deploy a strategy to reduce and eventually get off your medications. So that's why we have this, to give you resources that'll help you get that job done. Here's another way. The supplements are 10% off tonight, but there's another way that you can save money. It's by giving us a 5-star review. How many of you guys read reviews online? All the time. All the time. I'm buying stuff. How many of you guys buy on? I'm not endorsing Amazon or whatever. Like, but so, you know, I like to shop a little bit. I don't like to leave my house. So I'm all over the internet, and if I see, 3 stars, no, I go to the next one. If I see 4.5, 5 stars, and there's like 300 people that reviewed or 5,000 people that reviewed, I'm like, that's why it's an Amazon best choice. That's why it's a bestseller. And that's where I go. And so what we're starting to find is there are a lot of people out there in the community that are hurting, they're suffering, and they're looking for what we have here. How many of you guys learned something life-changing tonight? Yeah? Do you think it's a blessing to learn what you've learned tonight? Yeah, I love doing it. I love the fact that you're getting it. But that's only one chapter. I mean, the rest of the book is like our whole community out there that's not hearing this and not getting this, and are dead sheep, going off the cliff. And these are people that are looking for healthcare providers in the community. They don't know where to go. They don't know who to listen to and who to believe. They see 5-star reviews. People like me and you, they read those reviews. Guess what they do? They call us. So many of you guys have been very, very kind. You've referred people. You've told them, how well we've taken care of you. You've highly recommended us. That's word of mouth. And we love you and appreciate you for that. But this is kind of the same thing, but it's anonymous. You're putting your story out there, literally 2-3 sentences, 5-star review, somebody reads that. You're doing the same thing. You're not saving one life, you're saving multitudes of lives, and you never even know. You're just putting it out there. You're casting your bread. So that's why I always ask you to do this. Write us a review, so not for us, so you could find those people who are lost and hurting and suffering, so they could help find their way here. Does that make sense? Yeah. Now, if you do that, you get one of these gift certificates. You get 25% off any supplement you want. So we hope that you can help us do that. Just give me 5 more minutes and we're out. And my wonderful video again.
High blood pressure, it affects millions of people. In fact, 1 out of every 3 Americans. And if left untreated, it can be deadly. Most people take medication to control it. But as Kate Merrill shows us, some patients have found a simple way to keep their numbers down without drugs.
The mad dash to get the kids to school. The crazy commute. And especially work. It's enough to raise anyone's blood pressure.
We work on deadlines, and with all the law changes, which keeps me in business, but keeps us also pretty stressed out.
Soon, that pressure from running his Cambridge accounting firm began to take a toll on Adrian Kaspar. He was forced to go on medication to control his blood pressure.
I believe in not taking medication, but blood pressure you don't fool around with. I just have you sit right here, Adrian.
That's why he came here to Dr. Peter Martoni, a Linfield chiropractor, who's using a new adjustment in the neck to help bring down blood pressure.
It's not new.
Bone is out of alignment, putting pressure on the nerve. It interferes with the ability for the heart to function correctly.
In about 2 or 3 weeks, my blood pressure was normal.
Bill Bird of Stoneham sells cars, another stressful job. He was also on blood pressure medication. After a few visits to Dr. Martoni, his doctor cut his medication in half.
Another 30 to 45 days, my blood pressure staying at the levels it is, I'm going to be off at 100%.
This treatment is experimental at this point, but studies show it might actually work.
This is a very novel concept.
Dr. George Bacris is an expert in high blood pressure. He's conducted a small, carefully controlled study with some of his patients at the University of Chicago Medical School. He sent them to a chiropractor for the same adjustment Dr. Martoni uses.
We saw miraculous miraculous changes in blood pressure. We're seeing 12, 13 millimeter reductions in blood pressure.
The results were dramatic.
That's encouraging, isn't it? Yeah, so up until this point, we've talked about supplements and we talked about nutrition. You got to remember, the core four is function, fitness, nutrition, and education. If you eat good and exercise and you've got a bone out of alignment here, jamming into the brainstem, you may not necessarily feel it, but if it's kinking the artery, bringing the blood to the brain, it's interfering with your blood pressure. And that's one of the most commonly overlooked things that we see. And look, even the medical community is recognizing it. It's been known for years and years, but you're not seeing this often enough to where everybody knows you should be having your spine checked on a regular basis to make sure that you're preventing blood pressure issues. The top part of the neck controls the blood supply to the head, and it can cause anywhere from blood pressure problems to headaches, nervousness, insomnia, tiredness, dizziness, nervous breakdowns. People come in with neck pain. When I show them this chart, they're like, oh yeah, I got that. I have insomnia. Yeah, I have chronic fatigue. I have nervousness, headaches, anxiety. Yeah, I've got all that. And then they're on these medications. And of course, their doctors never told them to check their spine. And then we start taking care of them and adjusting them. And you see changes in all those areas. Here's another area, the top part of the back. Goes straight to the heart. Can you have a heart condition because a bone's out of alignment in your back? Of course you can. Your spine is no different than a circuit breaker. You can go up and down and find any symptom that anybody has ever suffered from and been treated with drugs. And if the drugs worked, you wouldn't have to take it for the rest of your life. If the drugs worked, you wouldn't have to take it for the rest of your life. Is that true? Yeah. That's why it works the opposite here. If we could find it and fix it and remove the interference, then your body heals itself. Yes?
I'm on 5 blood pressure medication 2 years now.
5 blood pressure medications for 2 years now. Thank you for sharing that. That's an awesome testimonial. Everybody heard that? Praise the Lord. And it's not that I have a treatment for blood pressure. With Angie, we just checked it, removed it, and it's like, it's like watering a garden, that hasn't been watered in a long time. Automatically, that's just what's supposed to happen, right? That's just what's supposed to happen. Healing is a natural event if you find and remove the interference from what's stopping your body from working the way God designed it to in the first place. Doesn't that just make sense? Not a message you hear every day because it's not profitable for the drug companies, right? So when we check people in the office, we check them for something called subluxation, which interferes with the normal function and healing of the body. And the problem with subluxation is that by the time people come here, when they're already in pain, yeah, that's one thing. But most people are walking around with subluxations and they don't feel it because most of those nerves are not pain sensitive. And it's no different than a cavity. You walk around a long time and you don't really know it's there. And by the time you feel the pain, it's what? It's too late, yeah. Well, a lot of times people come in and it's not too late. You just have to get it checked. But at any rate, I'm talking to guests right now. I don't want to preach to the choir. There's a couple of guests in here. If you don't have a chiropractor, the way to analyze the spine, if you're having any health issues, having any symptoms, or you just want a preventative evaluation, the way to do it is to test and not guess. We can check with posture, range of motion, palpation. We do thermography. We use a thermal scan, which is NASA space technology. And then if it's medically necessary and indicated, we'll take x-rays to confirm that. And then when we put everything together, it could tell us what shape your spine is in and whether you need help or you don't need help through chiropractic. Now, if you haven't had that done in a while or ever, how many of you guys would agree it's probably a good idea to have your spine evaluated from a chiropractic perspective every once in a blue moon? Yeah. So if you're a guest in here and you haven't had that done in a while, we're happy to do that for you. Normally, the exam, the consultation, I'll sit down with you in my office for 10 minutes. We'll talk about things, about your history, your family history. Then we'll do an examination. And the x-rays, everything normally included is well over $300. But as a guest here tonight for the event, we do that for only $47. And that's on behalf of the guest or the patient that brought you in. So we're happy to do that for you if your health is important to you. I don't want to lure you in. I don't want to entice you because that doesn't do anybody any good. I love sitting in front of people who take their health seriously because that's a win-win. You get to see results and I love seeing that also. So only make that appointment if you're serious about your health because I really appreciate you being here. But more important than the information is what? The application, right?
Yeah.
Deborah, can you raise your hand? All right, so if you're a guest, turn around and see Deborah over there. If you want to make that appointment and she can get you dialed in for the exam, the x-rays, everything, that whole first visit. 100% of that $47 goes to our mission to Haiti that we support. And these are some of the pictures from some of the structures that were destroyed in the earthquake and what we helped to rebuild, and we continue to support them. Tom Brady. Does anybody here not know who Tom Brady is? So I saw this on Facebook and I decided to grab it, and I thought this was pretty appropriate. He said, chiropractic just makes you feel so much better. When I walk out of the clinic, I feel like I'm about 3 inches taller and everything's in place. As long as I see the chiropractor, I feel like I'm one step ahead of the game.
Wow.
So he said this long before he won this Super Bowl. He probably said this like 7 Super Bowls ago, because he started getting adjusted before he won his first Super Bowl, and they still have the same chiropractor, and he's got every ring. The chiropractor has every ring that all the other players have.
Wow.
I wish it was me, but it's not. But what's the point? The point is that you got a multi-million-dollar player there who uses chiropractic for one reason: not to clean up from injuries, for performance, speed, strength, agility, response, recovery. You know, making sure you're firing on all cylinders. If it gives a Super Bowl top-ranked, the best possible quarterback in NFL history the edge, and it's good for him, who else should it be good for? Everybody. Yeah. You, your family members, your kids, your grandkids. Who here believes that they should be 100% of their God-given potential? All of us. That's what chiropractic is about. You know, I'm often picking up the pieces of when people come here when they're in pain. But my objective is to make sure that you use the tool the right way. And that's what it is. Chiropractic keeps you at your best. I'll help you feel better, you get out of pain if you got some pain, but the most important thing I could do is help you perform at your best. And I want to thank all of you here. If you've been patients for weeks, months, years, whoever you are, thank you for taking care of yourself and giving me the opportunity to take care of you. I mean, I can't do this over the internet. I come into work, I lay my hands on you, and I get to watch God go to work. And you know, He's my co-pilot. So what an honor that is to work with you. And I want you to know how much I love and appreciate you. Now, you got some homework to do, don't you? Right? What's your homework? Make sure you make application. Take everything that we learned tonight and put it to good use. If you need supplements, get the supplements while we have them. If you need the testing, the inflammation, the vitamin D, talk to Deborah. If you need an appointment, talk to her. But put the rubber to the road. You know, make sure you're here for next month for the workshop, and we keep building one on the other. Love and appreciate you guys.
Thank you.
God bless.
Thank you.